I've been taking care of patients in Tennessee for 12 years. For the last 6 months, I've cared for patients critically ill from COVID-19 in our COVID ICU. Last week, I recorded a message to Governor Bill Lee pleading with him to take the public health measures necessary to get Tennessee's COVID crisis under control. Simple measures like mandating masks, improving testing and tracing, and calibrating reopening to the number of cases and deaths in the region. Days after recording that message while caring for critically ill patients in our ICU, I was exposed to COVID, and yesterday I developed fever, chills, cough, and shortness of breath. This morning, my test came back positive for COVID. I feel frustrated, I feel angry, I feel scared. When Tennesseans died of COVID in March, this was a new virus that we didn't know what we could do to prevent its transmission. It's not March anymore. Through effective leadership, many countries around the world have implemented mask mandates, testing and tracing, the other simple things that we know are effective in preventing transmission, and have eliminated new cases of COVID in countries. The leadership of Tennessee chose to do the opposite. Governor Lee has claimed for months to be pursuing a targeted approach in which every county, city, and school is left to fend for themselves. That approach has failed. We have more cases and more deaths now than we did during the initial surge. Having seen people younger than me die of COVID, I'm wondering what the next 2 weeks will look like for me, and whether I did the right thing for my family to volunteer to be on the front lines of this and take on this risk. Governor Lee, I don't understand how you can ask us to do this, but you won't take the very simple, free steps that are needed to adequately protect us. It's not March anymore. It's not March anymore. Every patient who dies of COVID in Tennessee now is a death that could have been prevented. Governor Lee, their blood is on your hands. I encourage you to man up, to listen to the scientists and physicians who are telling you how to prevent these deaths in Tennessee, and to be a leader for the state by doing the simple things that are needed to keep the rest of us safe.